Good evening, everyone. My name is Kirsten Pilati, the very proud CEO of Breast Cancer Network Australia. Well, welcome to another full webcast by BCNA. Tonight, we'll be looking at the psychological impact of breast cancer. But before we get underway, I'd first of all like to pay tribute to the custodians on the land on which we meet tonight, the Wurundjeri people from the Kulin Nation. I pay my respects to the elders, past, present and emerging, in every location that you meet with us here in Australia. I particularly like to pay tribute to our Aboriginal and Torres Strait Islander First Peoples and say to them we know that this has been a very difficult time for you right across the world. So we welcome you to the network and we hope that you will get some really practical help through and life after breast cancer. So tonight is a very busy night. I want to get straight into it. We have two very special guests. We have Dr Charlotte Tottman, who's coming to us from Adelaide, so it's great to have the South Australians here with us, and Jodie Lidecker, who we'll hear from in a moment. But before we get underway, I just wanted to talk about the importance of Cancer Australia, who are providing the funding for tonight's webcast. Cancer Australia have provided a number of influencing best practices in breast cancer, and what it really does is helps to provide consumers with all of the information to ensure that you receive the very best treatment and care. And I'm so thrilled that BCNA played a very large role in pulling these together. But the thing that's most important about these influencing best practices is that they not only look at the treatment elements of a breast cancer diagnosis, but also the very important supportive care, the area that we know can impact so many of you long after your breast cancer treatment has finished. So I want to get straight underway and welcome our very amazing Dr. Charlotte Tottman. Charlotte came to BCNA through a forum in Whyalla, and it was from that very moment that we said we were never going to let go of this gem who can really help us to work through what are the significant challenges for you emotionally post a breast cancer diagnosis. So Charlotte, I know that if I do an intro to you, we would be here for most of the webcast. So I'd love you to do a short intro on yourself and then let's get underway and provide that practical support that you always offer our members.
Thanks, KP. So my name's Charlotte Tottman. I'm a clinical psychologist. The technical term for what I do is actually I'm a psycho-oncologist, which means that I'm a clinical psychologist who specialises in cancer-related distress. So I work in my own private practice in Adelaide and I talk about cancer all day, every day. I see cancer patients, their family members and carers, and I work with adults and children and families. Tonight I'm going to talk to you from three perspectives, and KP's going to help with my PowerPoint slides because I can't operate them from South Australia. So if we mess up the order and my speaking, I apologise in advance. So the second slide says that I'm going to talk to you from three perspectives. The first perspective is the theory around psycho-oncology. The second perspective is psycho-oncology from the point of view of my clinical practice. And the third is from the point of view of my personal experience. I was diagnosed with early stage breast cancer in July 2018. So I have, I guess, both the professional and the personal perspective to offer. So the first slide that I want to then move on to is about an analogy that I use to explain psychological distress when you get a diagnosis of breast cancer. I call it the stool analogy, and it's not that sort of stool. It's the stool that you sit on. If you imagine that your psychological well-being is the seat of a stool, and your psychological well-being, second slide please, Kirsten, is supported by a number of things. So the more legs that you have on your stool, and the thicker and stronger those legs are, then the more stable your psychological well-being will be. Most people, when they're diagnosed, have a stool with about 5 legs, and the 5 legs usually are things like family, friends, hobbies and interests, work or study, and physical health. So if you think about what happens when you get a diagnosis, next slide please, Kirsten, you start to have some of those legs compromised. You might suddenly not be able to work And as we go through these slides, Kirsten, just flick through the 5 of them and you'll see that the legs on the stools come off. So you might suddenly not be able to work. Your physical health gets compromised. Your relationships might change. You might find that you're surprised by the people who disappear and the other people who step up. You might find that you can't engage in the hobbies and interests that you normally would use to keep yourself feeling good and active and purposeful. And that leaves you with not much left to hold up your stool. So if you get to the last of those stool slides, you'll see a stool seat with one leg, and the stool seat doesn't look very stable anymore. And that's the analogy for your psychological well-being. So it's like if you feel like you're not quite so psychologically stable after a breast cancer diagnosis, then that's kind of why. Okay, so tonight I'm going to talk about the big 5. Next slide, please, KP. I've only got a limited amount of time, and this is the sort of stuff that I could talk about all day, which is what I do. So I'm just going to talk about 5 things quite briefly and hope that maybe that prompts some questions from you. And the 5 things are diagnosis shock, emotional isolation, body image concerns, relationship issues, and fear of recurrence. These are the things that, in my experience, affect just about everybody who goes through a breast cancer experience. Next slide. So what happens when you get diagnosed? Most people, and I can remember this so clearly myself, most people experience a really strong anxiety response. And most of us would recognise it as something like fight and flight. It's like you can hear the whirring in your head of all of this like white noise. You can't actually hear what people are saying to you. You might not even really be able to communicate very effectively just after the words are said to you that you've got a breast cancer or you've got cancer. Often the response to a really strong anxiety response is things like trying to take back control, because you feel like so much of your life suddenly goes out of control. You try and hold on to the things that you can control, and one of them is information. I can remember in the 48 hours after I was diagnosed, I was almost obsessed with who knew what, and I would hold on really tightly to the pieces of information, and I would dictate who could have which next bit of information. And that lessened up over the days that followed. But I recognised that it was my way of trying to take back some control when I was feeling like everything suddenly was out of control. You go into a situation of instant change, everything suddenly changes. You might suddenly not be able to do a whole lot of things that you had planned for that day, that week, that month, that year. And then you go into action mode. And weirdly, the action mode often helps deal with some of the diagnosis shock because it puts you back into a situation where you feel an element of control. You go into a treatment protocol and you feel like, okay, I'm able to do something about this now. And that sometimes settles down that first diagnosis shock feeling. All right, next slide, please. Then there's emotional isolation. This is best summed up as the feeling that other people just don't get it. And the truth is, they usually don't. Because if you haven't been through a cancer experience, it's a very hard thing to wrap your head around. And the thing about feeling like other people don't get it is that it can leave you feeling very isolated inside a very intense personal experience. And what happens when we feel isolated from others we would normally feel connected from is we often withdraw. So if you look at the next slide, it shows a cycle that really explains this fairly simply. The first part of the slide is where you can see that you feel emotionally vulnerable. And I think probably most people in a breast cancer diagnosis situation would recognise is feeling emotionally vulnerable. And we then seek emotional support from others. And it doesn't mean that we go out with a flag saying, here I am seeking your emotional support. It means we are just looking for it. And when we don't find it, when we fail to locate it or we fail to receive it, we do the thing that is, we withdraw. It's the one thing that is going to get us more of what we don't want, which is going to get us more disconnection, more lack of support. But it's the thing we do because we feel like if I retreat, if I withdraw, then I can't get any further hurt. And it's so counterintuitive to walk forward to someone who you feel like's let you down. You feel like you just want to walk away from them. But what we do is we emotionally, and that leaves us feeling even more emotionally isolated. So that's where things like BCNA can be so important because you can get empathy from people who have walked a mile in your shoes or something similar. You can get that understanding, that feeling that, yeah, they get it, where you can have a conversation where you can use shorthand. You don't have to go through the whole thing from the beginning because you just know that they understand where you're coming from. They understand the language, the treatment, the feelings. And so I say that empathy is gold. Go where you're understood. And BCNA is a really good environment for that because you find a network of women who will understand your experience. Next slide, please, KP. That takes us on to body image. Body image is body image concerns really common phenomenon for Western women. And the reason I highlight that is because what we recognise in psycho-oncology is that women often suffer with body image concerns well before they're diagnosed with breast cancer. But what happens with breast cancer and the changes that accompany things like surgery and treatment are that the cancer experience gives body image concerns a lightning rod. It gives them a focus. Suddenly we've got something to focus all of our concerns about how we look, how we present, our appearance to others. We've got something to focus on, the lack of breast tissue, the fact that we lose our hair or our eyebrows, the fact that we might have a stoma bag for a period of time. Things like that become the focus of our attention. The issue when we have changes is it can set up an identity crisis, and that's because if you imagine that every time you've looked in a reflected surface across the whole of your life, your brain's taken like a little photograph and it's filed that photograph in your brain's filing cabinet under a heading that says, this is what I look like. And when you go and look in another reflected surface and you don't have your hair or your breast tissue is missing, your brain takes a photograph and it files it in that filing cabinet in your brain. But guess what? It doesn't fit because you've got these other images that go, this is what I look like. And then you've got, no, this is what I look like. And that sets up this concept called cognitive dissonance, where it's like you've got these two competing ideas in your head and they don't fit. And that can be an identity crisis because then that's a really big deal. And the other thing about body image is there's lots of triggers. Lots and lots of triggers, things like getting naked, going swimming, personal care appointments, appointments with your medical team, trying on clothes when you need to buy new clothes because the ones that you did have don't fit you anymore because you don't look the same or feel the same. So there's lots and lots of triggers for body image, and that's what perpetuates the psychological distress that goes with it. Next slide, please, KP. The second to last thing I'm going to talk about is relationship issues. And these crop up in almost every relationship that you have. So it might be with your intimate partner, it might be with your children, it might be with your parents, it might be with your friends. And we usually find that we experience changes in relationships in many of those categories. And it can be really distressing. You can have expectations of people and they can let you down. You can be surprised by people who step up in ways that you never expected. It can lead to difficulties in sexual intimacy, and that can be quite problematic. And if there were problems or hairline cracks in relationships before cancer, often the cancer is like somebody puts a flame underneath those hairline cracks and they just open up. It introduces things like relationships. So you might have been husband and wife and suddenly you find yourself being patient and carer. And that's okay when it works, but the problem is that if I'm talking to my husband as my husband and he's talking to me as his patient, then we can get crossed wires and mixed signals, and that's where it can get tricky. I'll give you a quick example of that. My husband, when I was in treatment, if he'd say to me as his wife, darling, I love your veal parmigiana, would you make that for me? As his wife, I'd go, sure, darling. As his patient, I'd say, are you joking? That's the difference. We have these two different types of relationships running same time. And the other thing is that often I see women who are in what I call the sandwich generation, which means that they get diagnosed at the same time as they've got maybe a family of children and they might have ageing parents. So they're having to manage the competing demands of their own health stressor, their own health crisis, and looking after their children and looking after their ageing parents. So there's a whole lot of relationship issues that often crop up in the context of a cancer diagnosis. Next slide, please, KP. And the last thing that I'm going to mention is fear of recurrence, which is arguably the biggest and the longest standing thing that goes with a cancer diagnosis. Often I say that when you get a cancer diagnosis, on one hand, you get fear of recurrence on the other. And the fear of recurrence never goes away. It just sits there and it flares on occasion. The statistics around fear of recurrence are quite incredible. The research has found that 70%, which is a big number, 70% of people who go through a cancer experience have fear of recurrence. And so that means that it's really unpleasant, but really common. And I have it, and I'm pretty sure Jodie has it. And it's the sort of thing that will get triggered by things like a medical review, having to have a scan or a blood test. It'll get triggered if you hear something about someone else getting diagnosed, someone that you know, maybe even someone on the news. It'll get triggered by a symptom. You know, you get a pain in your back or another lump, and you will immediately interpret that as a sign that possibly the cancer is back. So it's a really visceral. The thing that I want to stress about fear of recurrence is that anxiety gets a bad rap. It's got a bad reputation. We think, oh, anxiety is a bad thing. The truth is anxiety is a good thing. Anxiety is a necessary thing. We need it because it's our burglar alarm. It's the thing that took you to the doctor in the first place, and it's the thing that will keep you safe if something else were to happen to you. So we don't want no anxiety. We want the Goldilocks amount of anxiety. Not too much, not too little, just the right amount. That's me. I'm done.
You are amazing. We gave you a very difficult task to wrap everything up in 20 minutes, and then we can open things up for questions. And I want to thank everyone who is already sending through questions. So Charlotte, you better sit tight because you have a busy next half an hour to go. So keep sending your questions through. These are fantastic. But as always, BCNA wants to make sure that we are founded on the voices and experiences of those diagnosed with breast cancer. So it's so fantastic to have Jodie Lydecker here tonight. So Jodie, can you tell us a bit about your own breast cancer experience? And it's always difficult to go after the clinician, but sometimes it can trigger other thoughts and things. So please welcome Jodie, and I'll throw it over to you to give us a bit of background about yourself.
Thank you, KP. Look, I feel like I've just, it was just a session of this was your life for the last 2 years, listening to Charlotte's slides just then. So yeah, I'm 2 and a bit years post-diagnosis, 28th of March, 2018. I think for anyone who gets diagnosed, that date becomes ingrained in your brain. And certainly for me, I think the 12-month anniversary was one that was really mixed feelings. You know, I was overwhelmed, I was excited, I was petrified. And in fact, this time around, you know, I just got through my second anniversary, and the day came and went and I didn't even realise. So for me, it was, the shock for me came because I was 40 and I'd been dealing with the GP about, you know, being geriatric in terms of fertility options. So I'd actually been investigating fertility options at that point. And then it was only through sitting in the doctor's clinic one day and I said, look, I've had this weird, you know, indentation on the outside of my left breast. It's there when I lift my arm. It's not there when my arm drops back. You know, have I put on weight? Is my tissue a bit strange? There's no lump. And I considered myself fairly breast cancer aware because my mum had had DCIS. And she'd had a double mastectomy only probably 6 months before this. And I thought, you know, I'll be fine. This is just me being paranoid. As Charlotte said, the anxiety was kicking me in the backside, but I ignored it for about 4 weeks and went to the doctor. And, you know, 2 days later, I'm getting told I have invasive breast cancer. And then 2 days later, you know, having surgery and then dealing with chemotherapy and then the prospects of being infertile and going into menopause at age 40. So, yeah, it's been one of those, you know, for me, I've found that cancer can be life-changing, even though initially, you know, the first response is that it's life-ending, you know, because I think a lot of us, and I certainly did, I heard cancer and I thought of death. I thought I'm going to die from this. And I think that's the trickiest thing in the early breast cancer category. you meet a lot of other women and men who get breast cancer, but a lot of other women who have, I was meeting women who were planning their own funerals, and I was tricking along, being cancer-free. And there's an element, I think, of survivor guilt, dare I say, at times when you're in the early breast cancer category and you're meeting women who have developed metastatic cancer or are stage 4. So yeah, it's been one of the absolutely worst and best 2 years of my life.
So I want to take some conversations and questions through, so please keep sending them through. But I first of all want to really identify what, Charlotte, is a really tricky time for the world right now. And it's, when you are diagnosed with breast cancer, you understand uncertainty. But on top of the uncertainty of a breast cancer diagnosis, you've now got uncertainty and these kind of really some very big world impacts that are going on. And it's not just COVID-19. How does that play out psychologically for cancer patients?
It's interesting and somewhat hard to predict. I mean, which is not surprising because the whole coronavirus thing has been unpredictable, unprecedented. The thing about uncertainty is absolutely that when we are diagnosed with a cancer, it introduces uncertainty in just about every part of your life. You don't really know what's going to happen, and there's a lot of anxiety that goes with that. But it's pretty much restricted to the individual. It's like what's going to happen to me, to my job, to my family, that sort of thing. The thing that coronavirus did is it broadened that. And if you imagine a circle, it just like expanded the circle. So it's not just what's going to happen to me, it's what's going to happen to my family, my extended family, my colleagues, my state, my country, my world. And that just takes uncertainty and anxiety to like really much, much higher levels. Having said that, I have had an interesting response from a lot of my cancer patients, which is that they have found the coronavirus experience, and particularly the restrictions that have gone with it, to be a little bit like Welcome to My World, where they have felt like, well, my world got upended when I was diagnosed. Suddenly I had to stay home. Suddenly I couldn't do all of the things that I wanted to do. Suddenly I didn't have an income. Suddenly. And now in the context of coronavirus, they're finding that a lot of their friends and family are going through something similar, but they're not sick. And so it's kind of like, well, maybe now you understand a bit better what I've been going through. So it's been quite fascinating to see that on one hand, there's a lot more uncertainty, which is obviously anxiety provoking, but there is also this kind of sense of, well, like, I guess maybe now I feel a little bit more understood.
Yeah. How's it been for you, Jodie?
Yeah, look, it was the worst timing in a way because I got diagnosed and was treated in Brisbane, and so I was living away interstate at the time, and I had only just moved back to Melbourne in January because what cancer did for me was made me realise that friends and family are so much more important than a career trajectory or anything else that might have been a priority up until that point. And 4 to 6 weeks later, all of those social networks and support networks really that I had come back home for were closed off. And I just thought, are you serious? Like, this is ridiculous. But in some ways it was the right timing because I'd also become quite anxious about, I'm now back home and I want to reconnect with all of these amazing friends that I've really missed. And I was almost wearing myself out. I was trying to catch up with everybody all at once. And suddenly I had this amazing, leave pass to just become a bit more inward looking again and time for me again, and not commuting and getting up at 6 o'clock in the morning and jumping on a train and trying to find time for me. And I think that's what it is, and also I think the mental health aspects of it. I have a really dear friend who has struggled with mental illness for a long time, and she said to me she doesn't feel like she's one of those weird, wacky people that, have to have some sick leave every now and then because everybody's got mental illness. Everybody's struggling mentally. And so it's actually felt a lot more normal to say, I'm not okay. And, that's one of the hardest things to do when you are going through your own cancer diagnosis, just to say, I'm not okay.
And that's there are quite a few questions that are coming through around this, Charlotte, around this normal. And I think we know that there is, you don't go back to normal. What are some of the strategies for people who are feeling like that they're stuck, that they can't get back to the new normal or back to normal? And the other question that's coming through is how long is too long when they need to actually go and seek some help?
I think there's still a lot of stigma around mental health, and people sometimes feel like they have to have a diagnosable psychiatric or psychological condition in order to justify going to see someone like me. And the truth is you don't. I mean, if you get a mental health care plan from your GP, they will want to have something like a word like anxiety or adjustment or something like that on a form that they fill in. But if you're struggling, there is no need to wait any length of time. I see people from literally the day they're diagnosed. Sometimes I don't see people until it's years after they've finished their hospital-based treatment. But if you feel like you've been feeling really anxious or stressed or overwhelmed or like you just can't get it together, and that's been going on for a couple of weeks, that's long enough. That's long enough to go and get a mental health care plan and make an appointment with a clinician. In terms of returning to something approaching a normal situation or a normal life, one of the things that we know now is that recovery physically and psychologically post-hospital-based treatment, so that's the end of things like surgery, chemo, radiation. From that point, from the end of that treatment, you can expect that your recovery period will be 2 years or longer. So it's not a situation where you get to the end of hospital-based treatment and you just snap back to your old life. That's not going to happen. It's not actually ever going to happen that you're going to snap back to your old life. You're going to snap back to your new life, to your new normal. And I call that, like in my case, I call that Charlotte 2.0. And Charlotte 2.0 does some stuff differently. You know, I go to bed at 9 o'clock. I carry a little pouch with a whole lot of medication in it that I didn't used to. And the tricky thing about our expectation of going back to normal is that we take with that a whole lot of expectations of ourselves. So we think that we can do things the same way, to the same standards, in the same amount of time, have the same energy levels, and be the way that we were before diagnosis. And what that sets up, those expectations set up, is messages of failure and disappointment when we aren't able to live up to those expectations. So sometimes it's about actually adjusting or recalibrating your expectations. And this will sound weird, but I use maths for that. So if something used to take me 3 hours, I say I allow an extra third to a half. So something used to take me 3 hours before. Now I go, okay, it's going to take me 4 or 4.5 hours. If I used to do something like clean the windows, and I used to do it because I'm a perfectionist, I used to do it to 100%. Now I do it to about, 80%. And I go, yeah, there's some streaks, there's some dribbly lines there. That's all right. It's all right. It's fine. So that's the sort of stuff which we need to do in order to be able to cope with the fact that things are different and won't go back to normal.
And one of the things I love about Charlotte 2.0 is that she only hangs out with people that she wants to hang out with people. And Jodie, on that friendship element, you know, you were in Queensland, you came back to Melbourne.
Yeah.
How did you deal with some of the friends who, as Charlotte kind of said in her overview, disappointed you? Like, talk me through how you've kind of processed that.
Yeah, I had, and it's exactly what Charlotte said. You know, I was really surprised and bitterly disappointed at the people that I thought in my inner circle would step up for me and didn't. And I was just overjoyed and I guess pleasantly surprised at the way that people that I'd only just met did step up and, you know, became one of those amazing, you know, networks that, you know, would say, come on, get out of the house, let's go and get a coffee, or let's go and do a pub, you know, event or something. And I'd say, oh, I don't really feel like it. They were the ones that actually just accepted me for me. I found it really difficult coming back to Melbourne. I would literally have people that I had worked with, you know, 5 years ago that walked straight past me in the street because they didn't recognise me anymore. And you know, and it's hard because you have to, you know, explain yourself and justify yourself. And it's, you know, you're trying to explain this is me now. I've had this cancer experience, and people don't know what to do with that. They don't know how to respond to it. And that's even for the people that are on the outer periphery of the friendship circles. My oldest friend of 20 years, I had to say goodbye to her. And that broke my heart. And it's still a grief, it's still a loss that I carry with me. She was there for me for the first few months. And then, cancer became all about her instead of me. And it's one of those times in your life when it absolutely is about you. That's the one time in my life that I said, this is about me, and I'm going to be selfish under the banner of survival and self-preservation and self-care and all those things. And if you can't be here for me, well, then I can't emotionally trust you anymore. And so I had to make a choice about some of those people that really disappointed me. Did they make an effort to walk back in the door after they'd walked out? The answer was, for some of them, yes. And to this day, some of those friends of mine have never responded to the text that I sent them to say I'd been diagnosed. And so those people are no longer in my life.
And Charlotte, what is that about, that response that people have that's seemingly to the person, to the woman or the man diagnosed, so inappropriate? What is that really about?
It's about stuff that they've got going on. So it's about the fact that we all come to the now through the filter of our previous experience. I'll say that again. We all come to the now through the filter of our previous experience. So if they've got issues of their own, and it might be that they've got a cancer experience, or they've been close to someone who's had cancer, or they hear the word cancer and they find it very scary. They feel uncomfortable. They worry about doing the wrong thing, so they do nothing at all. It's really common for people to act with good intent, but to get the execution wrong. So they try and do something, but they misfire. They do it in a clumsy or a clunky way. And I think that for the people who are going through the cancer experience, there's often not a lot of time and not a lot of space for the clumsy and the clunky. And I know I've experienced that myself. And we feel like, well, I'm the one going through this and I need the support, and I can't be there to make this okay for you. People are scared by cancer, so it's usually fear that sits behind their behaviour.
Yeah, and I found that it's that innate sense of someone wanting to fix the situation and have the right thing to say to make you feel better or to solve the problem. And the reality is, there's absolutely nothing anyone can say to you to make it better, to help you say, okay, I know I'm going to be okay, because nobody knows. Even the medical specialists don't know. They won't know, whether the cancer is going to come back. They won't know how you're going to respond to treatment. And I think it's that fear of not being able to say the right thing that stops people saying anything at all. And sometimes what I needed to hear was just, I'm here for you. And all I needed to say was, I'm not okay, and I just need a hand to hold. I don't need someone to fix the situation or make me feel better, because actually nothing was going to make me feel better at that time.
And what Jodie's talking about there is validation. And sometimes that's all we need. And it sounds like a small thing, but it's a really, really big thing. And that ability for another person to sit with another person's distress and just say, I hear you, I get it, I see it, and not try and fix it, not challenge it, not dismiss it, and not be scared by it. And we're not really practicing at that we're not socialised around it. We're not taught at primary school how to validate somebody else's experience, but it's a really important thing.
But it is a practical thing that people can take from tonight, is that actually verbalising it and telling your friends, I don't want you to fix it. And, mean, then we'll get on to partners in a second, but who definitely want to fix everything. But maybe it is where you start that conversation by really owning how you're feeling, so they almost putting them at ease. There was a question through, or a comment actually, from Kathy, who said that she absolutely understands where you're at, Jodie, and feels so disappointed. And then when the cancer returned, it was even more devastating and even harder for people to understand that. And I think that is very real, and the feeling and the sense that people with metastatic disease have is another whole session that we have done as a webcast, but also a podcast. So I'd encourage you to link into other information and support that we have on the My Journey online tool, because they really explore some of those other bigger challenges. Charlotte, some practical advice on the fear of recurrence.
The really common thing with fear of recurrence is the misinterpretation of bodily symptoms, and I am so across this because I do it myself. So the thing that we do is, I say, usually the language I use around this is the first thought is the worst thought. So you're lying in bed and you roll over and you feel a little bit of a creak or a pain in your rib, and the first thought is, that's it, the cancer's back, it's metastatic disease, I'm going to die, that sort of thing. And it's a little bit like putting all of your eggs in one fear basket, and it's really hard to do, but what I encourage people to do is to not let your thinking stop at the first thought. So I'll allow you to have the first thought, because I have that thought too, so I can't tell you that it isn't metastatic disease, but what I do say is come up with 2 other explanations for that same pain. So I had a fabulous client a number of years ago, and she came down to see me after been about 3 weeks since I'd seen her, and she was really concerned about a pain in her rib, and she was absolutely convinced that the cancer had spread. And we talked about it for a while, and then we went on to talk about other things, and she said something about planting trees, and I said, when were you planting trees? And she said, on the weekend. And I said, how many trees? And she said, 6. And I said, how big were they? And she said, like this, like about a metre across in terms of the hole. And I said, who dug the holes? And she said, me and my husband. And I said, have you ever dug trees before? And she said, no. And I said, do you think that might be something that might be causing the rib pain? Hadn't even occurred to her, because she was so fearful about the rib pain being a sign of metastatic disease that her brain hadn't allowed her to go to another place where she considered another alternative. So we came up with 2 other alternatives. One was that she'd actually injured herself, and the other was that because she was in her mid-60s and she didn't do a lot of physical exercise, maybe she'd actually just was stiff and sore, and it was radiating from one particular spot. So what that did was we came up with 3 explanations for the same event. So the event was the rib pain, and we had 3 explanations instead of 1. So it's a little bit like spreading your 100 eggs into 3 baskets rather than 1. And what that does is it takes the sting out of it. It takes the intensity out of the fear. And then what I say is, I want you to monitor that symptom. I want you to monitor it for a week or 2, and I want you to think about it as if you would be treating your child if you're a mum. So if you've got a 7-year-old and they come to you with a headache, do you rush off to the emergency department straight away? Probably not. What would you do? Probably sit them down in a quiet room with a glass of water or something. And if the headache was still there in a couple of hours, you might give them some Panadol. And if the headache was still there in a day, you might make an appointment with the GP, and so on and so forth. But by treating yourself the way that you would treat a child, you actually kind of set a little bit of distance between you and the symptom, and you allow yourself to engage on a practical level rather than an emotional level.
Yeah, that's fantastic. And the other, I think, very practical support, when we started, in fact, it was 10 years ago that we put our online community together, which is peer-to-peer support. And the one thing you can be sure of is that if you're up in the middle of the night worrying about something, so too many other women who have been diagnosed. So you can always go to the online network, and I can guarantee you someone else will be up worrying as well. So often that whole peer support that you can provide is really important.
Absolutely.
Now, Charlotte, this next question, which comes from Elle, is a very big one, and we're obviously not going to be able to cover all of it, but there's 2 key elements to what Elle's saying. One is that she was diagnosed with DCIS, so ductal carcinoma in situ, and for many clinicians, they will often say to a woman that this is precancerous or that you don't have cancer, and this is what happened to Elle. And that has actually gone on to have a very big impact for her, including having some post-traumatic stress disorder. What are some of the tips you can give for dealing with the failed healthcare system with health professionals who just often get it wrong but actually have a lifetime impact on a woman with those important words?
So I think one of the reasons that sometimes clinicians are in a hurry to downplay things like DCIS is because they're trying to be reassuring. They're trying to say, this is good news. You don't have cancer. You are in the best possible situation, not understanding that they are in fact being completely invalidating, which is just what we were talking about before, that need for us to feel validated in our experience. So I think that I would say a couple of things about experiencing that, about someone experiencing that. One is that if you are talking to oncologists and breast surgeons and being treated by oncologists and breast surgeons, that involves things like surgery, chemotherapy, radiation, hormone treatment, any of the options available, if that's how you're being treated, then you have cancer. And allowing people who may have good intentions or may be ignorant or otherwise, allowing them to dictate the terms of your experience is not appropriate. It's about saying, well, they've got their own stuff going on, whether they're trying to be helpful or they're coming from a position of ignorance. Regardless, that's their stuff. That's not my stuff. My stuff is I do have cancer, and I own that. And if I'm looking to them to validate it, I'm going to be disappointed. So I need to look to other people who do get it. And that's where I come back to that earlier point I made about empathy is gold. Go where you're understood. Talk to people where you do feel understood. Something like PTSD is a very serious condition, and it relates to, so PTSD is post-traumatic stress disorder, and it results from a traumatic experience. And it's diagnosed when somebody is still exhibiting trauma symptoms more than a month after the traumatic event. And so often it can be, and we see this in all sorts of ways related to cancer, but also lots not related to cancer, where there's one defining moment where somebody says or does something that makes us feel like our whole sense of self has been challenged or violated. And I suspect that that's something like what happened to Elle. And the clinician who said it, I suspect, had no idea of the strength of their position relative to Elle. There's a big power differential thing that goes on in medicine, where the person in the white coat or the person sitting across you in the medical specialist has the power, and they don't necessarily always appreciate the potency of the words that they say on the psychology of the person receiving those words. So I suspect that it was ill-advised. It may have been said with good intent, but it was received in a way that was very damaging. And post-traumatic stress disorder requires specialist treatment for some time that revolves around reprocessing the events and coming to understand it in a different way than the way the brain processed it initially.
Look, we did in 2018, we did State of the Nation, where we interviewed and did a survey of more than 15,000 people. And it absolutely demonstrated that we still have a long way to go around the way the health professional interacts with a woman or a man who's been diagnosed with breast cancer. And it's one of the reasons why in the top 9 of our urgent priorities for action, it is that all health professionals undertake mandated communication skills, because we know that one word, one sentence can actually have an enormous impact on a person long after their treatment has finished. And in actual fact, we also know that often it's after treatment's finished that all of this emotional kind of stuff comes up. And I think there's many questions coming through about when is it okay, like when should I be over this, when should I be back? And there is no time, there is no certainty for people, and everyone will react so differently. We are like on time, but I'm telling the people back in our studio we're going to go over a bit because there's too many questions coming through and we haven't even scratched so many surfaces. But I want to ask about Jodie telling you're a twin, telling your sister, especially given your mum had also been diagnosed with DCIS.
Yep.
So how was that for you?
I still remember. So I had told mum first. So I went into the screening clinic that day on my own. Stupid now, in hindsight. I wish to God I had taken somebody with me, but that was partly in denial as well, I'm sure. My first act, I guess, other than collapsing on the floor in the courtyard outside the hospital to ring mum and tell her, was trying to figure out how on earth do I now tell my sister, my dad, my best friend, my partner. So mum said that she would tell Susan, my sister. And it was still one of those things, a few hours after I'd gotten home and the shock was still well and truly, I was still wearing it all over my face. And my concern was I need to ring Susan and see if she's okay about my diagnosis, not the other way around. And I think that's because, we're twins, but I've always had that, protective big sister. And I was laughing with you earlier, KP, about, I'm 3 minutes older, but sometimes I've, over the years, I've felt like I could be 3 years older, not 3 minutes older. But I wanted to protect her and I wanted to make sure she was okay. And she wasn't okay and I wasn't okay, but I didn't want to break down. And I think that's one of the challenges that, when it doesn't matter if you're the mum, if you're the stoic wife, if you're the, for me, I was always the one that, people would always look at me and say, oh, you're strong, you'll get through this, you'll be right. You're going to beat cancer's butt kind of thing. And that's not what I wanted to hear. I wanted to have permission to fall apart. I didn't want people to tell me to be strong and to be okay. And I think that's one of those things we mentioned earlier. It's that moment of being able to be brutally honest and say, I'm not okay. And actually, if you're not okay right now, then that's your stuff. I actually just need to focus on me.
Yeah. Charlotte, Angela has asked a question about telling kids, and in particular for her, it's about teenage kids. I know time is running out, but what are some of your top tips around the involvement of kids with a breast cancer diagnosis?
Always tell the truth. Don't ever get caught in a lie. Don't ever get caught in a fudge. So you might not want to tell the whole truth, but you don't ever want to get caught in a lie or a half-truth. The reason for this is because this stuff is big, and if children, adolescents or young children come to find out that what they are being told is not entirely true, then you have broken trust and you won't get that trust back again, and that will play out in all sorts of other much less important parts of your life. Because if they'll think that you won't talk to them about the stuff that really matters, then the stuff that doesn't really matter, you definitely won't talk to them truthfully about. It depends on the age. Adolescents enter what we call the abstract thinking stage at about 13 or 14, and that's where their brains are able to develop to a point where they're able to better understand the consequences of things. So when kids are in primary school, they're in what we call the concrete thinking stage, which means it's all about kind of what's in front of them and their immediate needs being met. So adolescents have the ability to understand a lot more. But the other thing is they're also adolescents, which means that they're often very introspective and interested in what they're doing and what their peers are doing, and not so much what their parents are doing. So sometimes it's a bit of a balancing act to find the time and the space to talk freely with them. The other thing that's important is to give them the opportunity at any time to ask questions, and that if you don't know the answer to the question, to say, I don't know, but I will find out by this time. So I will find out by Friday afternoon and I will get back to you, and then you follow through on that so that they feel like they are included and that there isn't anything that you will hide from them, and that they will get the accurate information directly from the source, which means they won't go to other people and they're less likely to go to Dr. Google.
Yeah, I think that's so true. And I think even if you think you're making a phone call quietly with your friend, you can be sure that they have heard it. And often they can blame themselves. So it's the importance of being honest.
and adolescents are very good at, depending on the personality, but they're very good at feeling responsible and wanting to fix things. So relieving them of that pressure and reassuring them that the medical team have got it covered. Again, depending on the medical team, the circumstances, the children, sometimes allowing them to have contact and to go with you to things like chemotherapy and to meet your medical team can be really valuable, because it turns those abstract ideas into concrete realities, and they can feel like, okay, I know that when mum goes to chemotherapy, this is what it looks like, feels like, smells like, sounds like, and that can be really reassuring.
I just want to say that, there is an overwhelming sense of support coming through from you, and many people have experienced the exact same thing that you talked about. So I'd encourage people to listen to our podcast who have had a diagnosis of DCAS, to listen to that. But also I think it's prompted for me that BCNA clearly needs to do a lot more in this area of this guilt that people feel like they're a fraud when they are diagnosed with DCAS. So I think there's been some really important messages that come through. In the last bit, it's always my favourite one, and the thing that no one ever wants to talk about, and that is sex and intimacy. Mm-hmm. Jodie, are you happy to go there?
I'm happy to go there.
Yeah, great.
Yeah. I think Eric's probably watching, so it's been a non-event. Really, it's caught up in a lot of that stuff that Charlotte talked about around body image. I have scars and lumps and bumps and things that I never used to have. I went through nearly 6 months of chemotherapy, so I lost all my hair. I gained 20 kilos. I've now, gone down about 10, but I'm still definitely not what I used to look like when Eric and I were together. We are still together. I should be a bit careful. Sorry, babe, if you're watching. We have had a really rocky time, and emotional intimacy, I think, is obviously a large part of physical intimacy. And because we had such a rocky time during my treatment and coming out the other side of that, there's a lot of emotional trust that gets lost along the way. Put aside any body image and body confidence. I think as women, when we do lose our hair in particular, a lot of our femininity and our identity and our sexuality, kind of goes down the drain along with our hair. That's what the experience was for me. So I don't feel sexy. I don't feel like I'm offering anything that's attractive, let alone someone who loves me dearly. And also, I've got all my hormone blocking medications that put my body into a state of, probably feeling like an 80-year-old. So I don't have any of that, libido and other things anymore ticking along. So it is really tricky. It is something that you have to work at. It's something that doesn't just come naturally anymore. And I have to make more of an effort, and so does he. And that's something, when we are living back together again, because we're not at the moment. I haven't seen him for a few months. He's in Brisbane under state border lockdown, and I'm obviously here. But it is something that, that we need to make more of an effort on, and I think it's a critical part of any relationship. Yeah.
And there is a lot of information on our website about this, because we absolutely know that this is one of those taboos that people don't want to talk about. But I think the first bit is actually knowing that you're not alone.
That's right.
And that this is what people are experiencing. And then the next is to go and get some help. But also I love, there was a question that came through, and I'm sorry that we have not been able to get to all of them. They're coming through so fast, but around a person being diagnosed and going, right, my life needs to change. I'm going to leave my husband. I'm going to leave my work. I'm going to get rid of anything in my life that doesn't make me happy.
Yep.
And I can tell you that they are some of the best stories that we often hear at our information forums around the country. And that kind of, when a woman takes back control post a diagnosis, I think can be a very empowering moment for many people to get absolute clarity about what's important in their life. Charlotte, I'm going to end with a question to you, which I really love this question, Gay. So it's for Charlotte. Does having the years of understanding of helping people with their emotions around cancer actually make it easier to deal with your own experiences of a cancer diagnosis?
Yeah, that's a really good question. So I was working as a psycho-oncologist a long time before I was diagnosed with cancer. And I think that it's an important distinction, because I think if I was only a psycho-oncologist because I got diagnosed with cancer, that's a different kind of headset. Part of the reason that I got involved in psycho-oncology was because both my parents died quite young from cancer, and we just have a really messy cancer history. It's kind of like a magnetic attraction to cancer. It's a little bit weird. So when I was diagnosed, it was kind of really interesting, because I had this kind of two-pronged experience. I had the personal experience, and then I had myself observing myself have the personal experience. And I did use it a little bit in a way to test out whether everything I'd been saying and doing up until that point in my professional life, whether it was a complete load of crap or whether it was actually kind of like on the money. And the thing that I found out was that it was pretty much on the money, except for fear of recurrence. I had not been able to understand fully the visceral fear that I now have in terms of my own mortality and the fear of the cancer coming back. And I don't think you can understand that unless you've lived it. So in terms of the other kind of elements of it, I think the answer is yes to your question. Yes, the work that I had been doing for a long time, it did inform me. It gave me the advance warning of the things to look for and the things to work on. And so when I hear things like Jodie's story about sexuality and intimacy, I know that my situation is a little bit different, because I knew that was coming. And Rob, my husband, and I were able to kind of get ahead of that curve. And it's not great, and it's not the same. And what I would talk about there is, I would say that not only is there Charlotte 2.0, but there's Charlotte and Rob 2.0. And our relationship is now in a different chapter than it used to be. So, yeah, it probably did help me in that respect. But it didn't do anything for fear of recurrence. I had to live that one to learn about that properly.
And you're still living it. And that anxiety is very common and very true for everyone. Jodie, I'm so sorry that I didn't flick through your
I wasn't
slides,
sure if they were loaded.
Look at these beautiful images.
Yeah. And there was, if you just go back one, there's a saying there that's sort of for me, but it's a Brene Brown saying there on the right-hand side. Only when we are brave enough to explore the darkness will we discover the infinite power of our light. And I think for me that captures all of what the last 2 years has been about. And, you know, as I had said on that, you know, healing is messy, but I think, you know, if, you know, for me, I carry cancer's ghost with me. That's how I describe it. You know, every ache and pain, I think, is this it, is it back? What if it comes back? For me now, I sort of more so think, well, what if it does? I will do exactly what I did 2 years ago. I will get on with it. I will figure it out, and I will be okay at the end of it. And I think that's just a really important message to leave people. You know, either way, we don't really have much of a choice other than to just get on and be okay in our own way. And you will. It takes time, but you will be okay.
And reach out for help. That is the perfect ending.
Absolutely.
I could hang out on the couch with you two for so much longer. And I know the messages through here have just been amazing, and how people have really felt reassured that they are not alone. And I think that is one of the big elements of this whole area. So from Jodie, Charlotte and myself, thank you so much for joining us. We're sorry we've gone so over time. I want to pay tribute to Cancer Australia, who continue to fund Breast Cancer Network Australia in the work that we do. Please get online to the My Journey online tool, myjourney.org.au, and there'll be plenty more information and support there. But I would also encourage you, if you need help, please reach out for help, and you can call our helpline on 1800 500 258, and our team will help you to navigate to the services that will be right for you. So from all of us, thank you so much, and have a great night.